Welcome to Healthline, which is brought to you by the Knoxville Academy of Medicine Alliance. I am Sheila Whitkey, your host. Today, my guest is Dr. Clyde Mathison, a physician who specializes in plastic surgery, and especially facial plastics. Today, Dr. Mathison and I will discuss the aging face and what we can do about it. Welcome to Healthline, Dr. Mathison. It's nice to have you again as my guest. This is going to be a good show, I know. Your skin changes with age. That is about a lifetime of sun exposure, personal habits such as smoking and diet, and also changes that happen, say, with normal aging. As you get older, you may notice your skin is not as smooth or tight as it once was. It may also be drier, more fragile, and thinner. And with age, skin may also bruise more easily due to loss of support around the blood vessel walls that occurs as we age. Excuse me, Dr. Mathison. What I'd like to begin today is, first of all, will you describe what happens, say, to our skin in the normal aging process?
Well, as we age, the main thing is the skin starts to lose all its structure. It gets thinner, it gets weaker. Years of sun exposure, years of hopefully no smoking, but a lot of people do, drinking, habits, diet, they all take wear and tear on the skin. The skin gets thinner. The fatty layer in the skin gets a little thinner. The ligaments that hold the skin in place get looser. Gravity's pulling on us all the time. And all these factors kind of add up to give us the aging face.
Yeah, good, thank you. And with age, the skin suffers natural wear and tear, as Dr. Mathison just said, just like the rest of our bodies. However, much of what we think of as natural aging is actually due to sun exposure, as Dr. Mathison said, and other factors. And these factors can be prevented. In fact, most of the skin changes associated with aging are avoidable. Wrinkles are caused from a combination of factors: aging, stress, genetics, hormone loss, collagen depletion, environment, and the sun. Some factors you cannot control, but you can control sun damage, smoking, diet or nutrition, and excessive drinking of alcohol. And Dr. Mathison, as I list each common factor that causes aging of skin, will you describe how the facial skin is affected and then explain some ways that we can prevent premature aging of the skin?
You had a great list there.
Thank you.
You hit all the big ones. Number one off the top, sun exposure.
Yes.
Yes. Radiation, UV radiation does major damage to the skin. There have been multiple studies that have looked at this. They've looked at people who drive trucks, truck drivers. They're in the sun all the time, and they have noticed increased aging on the left side of their face, which is the side towards the window, as compared to the right side of the face, which is the side away from the window.
Yes.
So sun exposure is the number one thing to cause premature aging of the skin, and thus wrinkles, sagging, jowls, etc. So avoiding the sun is the big one. Now, I'm not saying be locked up all. Yeah, exactly. I'm not saying being locked up all day, but wear a hat, wear sunscreen. That's the big one. Sunscreen every single morning is the number one thing you can do to help prevent wrinkles.
Great.
So, other things you mentioned, genetics. Can't really change who mom and dad are. You're kind of stuck with that one. So some people, unfortunately, don't have the best genes when it comes to skin, and they have looser skin, more wrinkle-prone skin. Really not much you can do about that one.
What about smoking?
That's another big one.
That's the second one on my list.
That's one you can definitely control. Smoking does absolutely nothing good for you.
Would you explain what the smoke does to our body?
Well, the smoke has chemicals in it. And those chemicals cause damage on a cellular level to the skin. And the skin sometimes can repair itself, but after years of just being beat down by that smoke and beat down by those chemicals, the skin can't repair itself as well. And then the skin starts to show signs of aging. And
the blood vessels too. The walls of the blood vessels
they get thicker,
are affected.
You don't get as much good blood flow. You can't heal yourself as fast.
That's true. That's a big one. How about excessive alcohol drinking?
Alcohol drinking leads to dehydration, and keeping your skin hydrated, very, very important. Avoiding alcohol, wearing a moisturizer. Nowadays they have many products that contain both a sunscreen and a moisturizer. You get the 1-2 punch in one product. Highly recommend that for all my patients.
That's wonderful. That's good. What about diet or nutrition?
Well, I tell my patients, if you eat junk food, you're going to look like junk food. That's
true.
honest truth right there. If you do not have a healthy diet, your skin doesn't show it.
That's true. Yeah.
So diet's very, very important as well.
Yeah. And you mentioned genetics. There's nothing we can really do about that.
Unfortunately, no.
But
maybe one day.
Yes.
Maybe one day medicine will get there, but right now, no.
Right. What about hormone loss?
Well, that does play a role. As we age, our hormones change, both women and men.
Yeah.
And that can lead to some premature aging as well.
Okay, good. Thank you. There are several treatment options for the aging face, both non-surgical and surgical procedures. And I want to discuss the non-surgical procedures first, which include Botox and fillers. And Dr. Mathison, what basically is Botox? How does it work? And where is it used most often in the face? And we hear so much about Botox. Will you explain it, please?
So Botox is a muscle paralytic agent. It's basically botulism is what it is. Mm-hmm. It's the actual chemical that causes botulism. It's made from bacteria. And the company that has made Botox, and there are other companies too, there's Zomin is another product that's very similar. What they do is they have purified it down to the poison level only. There's nothing else in it. And it's in very minute doses. And the way that the chemical works as in Botox is it keeps your muscles from working. It actually blocks nerve transmission. It paralyzes it. It blocks nerve transmissions from the nerves to the muscles, so the muscles don't work. Those muscles are attached to the skin, and they pull your skin down and cause a wrinkle. Mm-hmm. Well, if you relax the muscle, the wrinkle goes away. That's basically how it works. Now, where is it used? In the face, most often in the brow. Mm-hmm. In the glabella, that's the area in between the eyebrows. Mm-hmm. We'll see it in the crow's feet out here. Occasionally you can use it in the lips and other places, but the three big areas, the brow, the glabella, and the crow's feet.
Okay. I also read that, say, wrinkles caused by sun damage and gravity will not respond to Botox. Will you explain the reason for this?
It all depends on the depth of the wrinkle and how severe it is.
Oh.
Really deep, severe wrinkles are just too big. Think of it that way. They're just too deep. They're too big for Botox to work. Botox works on very fine wrinkles.
Okay.
That's the ones that it works on the best.
Okay, so in other words, more of a thin skin type person, would you say?
No, it's just, it's patients that have decided to treat the wrinkles before they've gotten too much sun exposure, too much smoking, too much bad diet, and just before their skin gets to that point. You will eventually cross a threshold where the wrinkle is just too deep, too severe for Botox to work.
Oh, okay. What basically, say if you're going to have a Botox injection, what are some preparations that the individual needs to make before you have the Botox, such as maybe stopping certain medications or something like that?
If you're on any sort of blood thinners, aspirin, NSAIDs, which is like Aleve, Advil, and then some of the heavier duty blood thinners, Eliquis, Coumadin. Those can all put you at higher risk for bruising afterwards.
Okay.
That's about it, though.
Okay, good. Will you describe now how the Botox procedure is done and how long it takes to do the procedure, and then explain how long the Botox injection lasts over a period of time?
It's done in the office. It's a very simple office procedure. Typically, I will utilize an ice pack just to kind of get the patient a little more comfortable, get them a little numb. We can also put topical numbing medicine on the injection site.
Like lidocaine or something?
Exactly, topical lidocaine gel. You just put it on the face, you let it sit there for about 5-10 minutes. Patient's pretty numb, wipe it off, and inject the Botox. It's a very, very small needle, smallest needle we have. It's not a very thick liquid. And so you can get away with a small needle. The whole thing takes 10 minutes.
Oh, really?
That's about it.
Oh.
That's about it. Now, Botox, in terms of lasting, the average duration is about 3 to 4 months.
Oh.
Some patients, it lasts a little longer. I've seen patients that it lasts upwards of 6 months, 8 months. I have patients that it lasts less than that, only 2 months.
Really? Now, how many times do you have to repeat it? And then, or is it safe to repeat it?
It is definitely safe to repeat it. And You repeat it whenever you start to notice that it's
The
wearing off.
wrinkles are coming back.
Correct. And one of the things that we have noticed is that patients that get repeat Botox injections, they notice that over time the injections last longer. So let's say you're an average patient, you come in and you get your Botox to your brow. It lasts 3 months. You come back in 3 months, you get it again, and you get it again. But then you start to notice now it's 3.5 months. Now it's 4 months. It starts to build. It gets a little bit longer each time.
Why is that? Is because the muscle is finally then adjusting to
Yes,
the Botox,
exactly
and so
what it
it's
is.
relaxing then.
That's exactly what it is.
And so it's, in other words,
So actually, it's beneficial to get repeat Botox injections.
okay. So it's the paralysis or whatever you want to call it, and then lasts
basically
longer.
what it is.
Yeah. Okay. What are the side effects of Botox, and who should not receive Botox? And does insurance pay for Botox?
We'll kind of take those in reverse order. Insurance,
Okay.
in terms of for cosmetic reasons, insurance will not pay for Botox.
Okay.
There are some indications for headaches, and insurance may pay for it. I never say always with insurance companies.
Okay.
They may
Okay.
pay for it for headache, but not for cosmetic.
Okay.
Who should not get it? There are certain neurological conditions. Myasthenia gravis is the big one. Those patients should not get Botox.
Yeah. And myasthenia gravis is a muscle disorder.
Exactly. It's a muscle disorder.
Yeah. And then you said, what are the side effects?
Oh, side effects. Poor placement. That's about
really?
the big one. Yeah. So that's why I always recommend that you go to somebody because there are many providers in town that are doing Botox. Make sure you go to a board-certified physician that knows what they're doing and has done Botox for years and knows the facial anatomy. Because the good thing about Botox is if you don't like it, it'll wear off in 3 months. The bad thing is about Botox, if you don't like it, you got to wait 3 months for it to wear off.
Okay.
So, because there is no antidote for it. Once it's
Okay.
injected, you have to just wait for it to wear off. And if the person puts it in the wrong spot, you get side effects that you don't want. You may have an eyebrow that drops. You may have an eyelid that drops. If you inject it around the mouth, very small doses around the mouth can help with smoker's lines. If you give too much, you can't move your lips very well.
Oh.
And it makes it tough to talk.
Yeah, I was noticing that after I read that also after you have the Botox injection that you should not rub that area.
I tell
because it
patients
could
just
move.
that they don't want to apply makeup for a little bit, and they don't want to rub it, correct, because you don't want to diffuse it out into an area that we don't want it to go to.
So it will move, the
It
Botox?
can. It
Yeah.
can.
Okay.
It can.
And then how long
You
does
don't
it
want to
take?
exercise for about an hour. You don't want to get the blood flow, anything like that, for about an hour.
How long does it take, say, for the effect to take for the
I
Botox?
counsel all my patients, expect nothing for 3 days. It takes
Really?
3 days before you'll notice anything at all.
Okay.
Then it starts to work. And after about 7 days, it's fully on board and working.
Okay, good. Okay. Injectable wrinkle fillers can give you a more, say, youthful look for a fraction of what traditional facelift costs. Most will fill lines and wrinkles in less than 30 minutes with results that can last from 4 months to more than a year and sometimes 2 years. Dr. Mathison, what are injectable dermal fillers and how do they work?
So a filler is a agent that is used to elevate a wrinkle. Think of a wrinkle as a valley in between two mountains. All right? And what the filler does is it fills up the valley and brings it up to a level equal with the mountains. So, and there are various options there.
So basically that's what it does, and
It fills.
it doesn't move or anything, it stays there?
It stays there.
Okay. What, say, issues or complaints would be improved, say, with
So
using
fillers
dermal fillers?
are great for those deeper wrinkles that Botox may not work
Cannot
very
reach.
well on.
Okay.
Correct. Now there are different parts of the face that fillers are better for
Okay.
as compared to Botox. Fillers are really good for around the mouth. The smile lines here, the nasolabial folds, the marionette lines down here by the mouth. Those are the two big areas in terms of wrinkles that fillers are perfect for. Botox, not so much. Fillers are great. If you have flatness of the cheeks, you can fill it
Kind
back
of sunken
up.
cheeks.
Sunken cheeks. You can add volume to the cheeks. As we age, we lose fat in our face and we lose that volume. Take a 1-year-old, nice fat round cheeks. That's youth. As we get older, the fat in our body thins out and starts to descend, and it goes to places that
Gravity pulls it
gravity
too.
pulls it down, that makes you look less youthful. And so we can fill the areas that were full when we were younger to give us a more youthful appearance. The cheeks are the big one.
Okay, good. I was going to ask you about the nasolabial
Yes.
fold. Can you get too much of filler in that area and
You
it
can
looks
always-
artificial, or what?
That is possible. That is possible.
How do you know how much to put in?
A lot of it is on the physical examination. You look at the patient, see how deep the fold really is, and then when you start injecting, you just go a little bit at a time.
Okay.
Inject some, kind of back up, look at the patient. All right, I need a little more right there. Inject some, back up, look at the patient. I need a little more right there.
Okay. Now, how do you?
And of
do you
course, the
have them
patient has
set
a
up?
mirror the whole time, so they're
You-
looking at it too to make sure they're happy with it.
So they're sitting up.
Yes, ma'am.
When you do that. Okay. So it doesn't make any difference whether they're laying down or sitting.
I
up.
have my patients sitting up.
Okay, good. Okay. As I list the different types of dermal fillers, as I told you earlier, I'm one of those that likes to know the ingredients before I put anything in my body. Will you briefly describe, say, the ingredients and then give examples of each type of filler?
Okay.
And the first one was hyaluronic acid, or HA is what we refer to it. What basically is it?
So hyaluronic acid is one of the most common molecules found in your body. So this is a natural ingredient. What the companies that have designed these fillers, what they've been able to do is basically, we call it cross-linking. They attach the molecules in these big long chains so they're more stable, so they last longer. That's really all they've done, and it works great. It's a natural product. Most fillers are HAs. Most of them are based on hyaluronic acid.
Okay.
Juvederm is the big one. Restylane, Bolotero.
Okay.
Those are the 3 big ones.
Okay. And is Voluma, is that another one?
Voluma is a subset of Juvederm.
Okay, okay. And the next one is calcium hydroxylapatite.
Calcium hydroxyapatite.
Yeah.
So what that is, it's little tiny microspheres of this product. And the interesting thing about the calcium hydroxyapatite, or Radiesse is the big one, is that it actually makes you form collagen.
Oh, it helps then.
It
to
helps
filler.
form collagen.
Yes,
So future injections, you don't need as much
that's
because
great.
your body has formed collagen around those little microspheres.
Okay.
It's really cool stuff.
Then the other one is polyallactic acid.
So this is Sculptra. And Sculptra is a